This is Radio Health Journal. I'm Nancy Benson. This week, what happens when patients open up about their whole lives.
One little thing, when you don't have much money, really can just explode into your life turning upside down.
What hard times look like to a doctor when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Throw away that old script and trust ourselves to improvise and relate in that moment. We'll get a much better result.
Flipping the script by practicing improv. Then
they would show this wall of categories, and you would choose your category, and the host would push a button, and an IBM sorting machine would start spitting out question cards.
We explore the game shows of the past. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Holiday spending has been way down this holiday season. That's no surprise with all the jobs lost to COVID-19 and the fear people have about their future. Even before the pandemic, 3/4 of Americans were living paycheck to paycheck. And 40% of us couldn't pay an unexpected $400 expense if we needed to.
Now, COVID comes along and you have this new health threat, and the poorest among us are the most vulnerable to COVID, as we've heard about and seen for the last 9 months.
That's Dr. Michael Stein, a practicing internist, professor of health policy at the Boston University School of Public Health, and author of the new book, Broke: Patients Talk About Money with Their Doctor.
First of all, poor people often live in close quarters, and we know that when you're spending a lot of time close to people and one of them's infected, that virus spreads around. Secondly, poor people often don't have infinite gloves or masks. Poor people are more likely to work outside the home than people who have a lot of money. People who have lower incomes are more likely to have chronic underlying diseases. They're uninsured. So for all of those reasons, COVID has laid on top of an already inequitable system that we have in the United States. COVID's just exposed the vulnerability of our poorest neighbors to a new medical problem.
Depending on your relationship with your doctor, you may be surprised to hear about patients talking finances with their physicians. Doctors often complain they don't have time to talk with patients about the medical part of their lives, let alone anything else. But Stein's been an internist in the same neighborhood for 30 years and says longtime patients open up about issues that start with health and go from there.
They talk about alimony payments and funeral costs and utility bills and cars breaking down. And sometimes they get to that through a medical problem, like, I can't afford a medication, or I didn't take the medication you prescribed me, doc, or I don't like this medical bill. But really, they just end up talking about their lives when you get to know them. And, we like to think that Americans don't like to talk about money, and maybe there's some class division in that, but I've found with my working class patients that they don't hesitate to disclose specifics about their income and their rent and what they spend.
One patient at a time, Stein has concluded that the economy is rigged against the working class with almost every purchase.
There's just no room for a mistake if you have very little money. And when you think about it, here's the simplest form of it where the life is stacked against you. Think about when I go to the supermarket. Maybe when you go to the supermarket, I will buy 24 rolls of toilet paper. I won't buy one, I'll buy 24 at a time. Why? Because if I buy a 24-pack, a roll of toilet paper costs about 40 cents, right? If I buy them one at a time, but I need to buy 24 of them at 40 cents a piece, I need 10 or 12 bucks. What if I walk in and I don't have 10 or 12 bucks? Well, now I'm just going to have the 1 or 2 bucks I have in my pocket. I'm going to buy one roll, and it's going to cost me $1. So here's a poor person paying twice as much per roll of toilet paper as I am. They have less money, but they don't have enough money saved up to get a 24-pack. So already you see every time they go out, they're in the hole. And so these tiny little things stack up in the lives of people without a lot of money.
Stein says being unable to afford even small things can often snowball into something much worse. For example, he once had a patient who sometimes didn't have the change to pay a parking meter, resulting in a few parking tickets. The patient didn't have the money to pay those either.
These parking tickets are unpaid. He gets pulled over by bad luck for a taillight that's out. They run his license. They see he has all of these parking tickets that are overdue. They suspend his license, at which point his car is then taken away. He can't drive. He loses his job because he can no longer get to his job. He loses his job, and therefore he loses his health insurance, and on and on. So you see what starts with a parking ticket ends up with somebody who has a medical problem, no longer has a job or health insurance, and comes to my office and asks, what can I do? And by the way, there's also, of course, a warrant out on him now that he has a suspended license and overdue parking tickets. So, one little thing when you don't have much money really can just explode into your life turning upside down.
So Stein says the way policymakers think of poverty is all wrong. It's not figures in a ledger. It's people who've gotten caught having too little for that thin margin of error and can't get out.
Poverty we think of as, when I put on my policy hat, right, I think of poverty as a number, right, that you're below the federal poverty line, and so you qualify for Medicaid or you qualify for food stamps. But, really poverty, to my mind, is a feeling. It's a feeling. One inhabits poverty. It affects every decision, including medical ones, that people make.
Stein says one study illustrates the change in mindset well. Researchers went to a mall and gave intelligence tests to both rich and poor shoppers, finding they did comparably well. Then they gave the test to another group, but first asked them to imagine that their car needed a $150 repair. Rich and poor again did just about equally well. Then the scientists changed the economics again for a third group.
Now you ask another group of people, what if your car breaks down and it requires a $2,000 repair of the car? And what you find is that the higher income participants do the exact same as if the repair required $150. And the low income people do incredibly much worse than if the repair was $150. In other words, there's something about just that idea of having, in the hypothetical, in the middle of the mall, that your car requires a $2,000 repair, and you can't do it. And that brings the lack of money to the front of your mind, and it causes this, what I would call a racket in your brain. And those with less money become, right there in front of you in the mall, preoccupied. And they don't do well. They don't think well. They don't do well on this cognitive test. And that's what happens in the world, that people without money are walking around in this sense of sort of scarcity. They don't have enough, what I would call bandwidth, to be able to deal with all of the things in their lives when money is in the front of their brain.
That's why Stein is filled with respect and admiration for his patients who survive despite the likely preoccupation and the long odds. He says today's new doctors are more apt to think about their patients' economic life than the old guard, but it doesn't really take much for any doctor to bring it up.
There are just a few questions that really doctors need to ask. It would be a lovely question to ask, and I think more and more pediatricians are doing this, and maybe more and more adult primary care doctors are doing this, is a simple question of, do you ever have trouble making ends meet at the end of the month? That one question, even asked to a relatively new patient in one's practice, really can open up the door to all sorts of conversations that are going to affect your medical interaction with that patient, because they're going to be doing things that you may or may not understand. The doctor is eventually going to have to say to them herself, what is poverty doing to this person, and what are the contextual factors that are distorting their choices and actions in the world? It's going to come to that. And if the doctor's not thinking in those terms, then they're naive.
Stein says sooner or later, virtually every primary care doctor will run into patients who are late for appointments or don't take their medicine. Not because they don't care, but because their car broke down or they can't afford the prescription. Reasons like those are why there's an 18-year difference in life expectancy between the richest and poorest counties in America. Dr. Michael Stein's book, Broke, is available now. You can find out more about it and about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Supporting immune function through a healthy diet has become an important new focus for many people these days. One key recommendation is to eat more vegetables and fruits, such as grapes, every day to improve immune function. Combining grapes with vegetables can help achieve this goal in a tasty way, according to registered dietitian Courtney Romano, health advisor for the California Table Grape Commission.
Fresh grapes are heart-healthy and hydrating and linked to benefits in multiple areas of health, including supporting immune function. Grapes are always a smart snack choice on their own, and they also pair well with other healthy foods such as vegetables to enhance flavor and nutrition. Add grapes to a kale, spinach, or arugula salad. Roast grapes with cauliflower or broccoli. Combine grapes with cucumbers and feta for delicious and healthful eating.
Grapes from California are a natural source of antioxidants and other polyphenols. Visit grapesfromcalifornia.com for more information and over 300 recipes.
A good night's sleep means everything no matter where you are. Luckily, there's a CPAP machine for home and away. The Philips DreamStation Go offers the best of both worlds, a lightweight and discreet travel CPAP designed for everyday use that can be carried wherever you go. Dr. Mark Aloya is Global Lead for Behavior Change at Philips Healthcare.
Most people don't realize that missing just one night of CPAP therapy, which happens often when we travel for business or for pleasure, can put you right back to square one. Now there are more options than ever for CPAP therapy with the recent introduction of travel-sized CPAP devices like the Philips DreamStation Go.
Whether you're at home sleeping soundly or chasing a new adventure on the road, the Philips DreamStation Go is the everyday travel CPAP you want by your bedside. Find out more at philips.com/DreamStationGo. That's PHILIPS.com/DreamStationGo.
With attention focused on COVID-19 during the past year, it's easy to miss important developments in other major diseases. For example, during 2020, the drug pipeline for Alzheimer's disease heated up, with 2 new drugs under review by the FDA, one that may slow the disease and another that treats symptoms of hallucinations and delusions. Over 300 other therapies are in clinical trials. Also in 2020, breakthrough research presented at the Alzheimer's Association International Conference brought us closer to a blood test for Alzheimer's. Such a test, once validated, would be an accurate, inexpensive, and accessible way to diagnose Alzheimer's. This would enable early intervention when new drugs become available. Other studies from the Alzheimer's Association International Conference suggest that getting vaccinated against flu and pneumonia after age 60 may have an unexpected additional benefit, reducing risk of Alzheimer's. Find out more about Alzheimer's research in 2020 at alz.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
We've done incredible, and there's huge support in the population across the world for these things. But that said, we've still failed.
How better messaging could get more people to wear masks and socially distance.
Then how childhood emotional trauma leads to poor health decades later.
The way in which the genes that oversee our proper stress response do not function properly for life.
All that and more on Radio Health Journal.